Meet Jake. He has sparkling eyes and loves to play with his dad. He doesn't know it, but there are medical and scientific discoveries being made that will allow him to grow, to live a long and productive life, and yes, even to soar. In the heartland of the United States flows a confluence of scientific and medical expertise. St. Louis Children's Hospital and Washington University School of Medicine have forged a partnership to unlock the mysteries of childhood disease. This is the Children's Discovery Institute.
There are only a few of these kind of multidisciplinary research institutes that are focused on pediatric disease, but you can count them on one hand. The genomic technology that resides in the Genome Sequencing Center and the Genome Institute at Washington University factors very heavily into the success of the Children's Discovery Institute. The technology is now becoming more and more affordable, and it's a very important part of what we do at the Discovery Institute.
CDI faculty scholar Dr. Todd Drewley, through the mentorship of geneticist Dr. Ravi Mitra, now uses cutting-edge genome sequencing to tackle a profound question. Why do children get cancer?
Pediatric cancers are not adult cancers, and while we have decades of experience understanding why adults get cancer, the reasons why children get cancer have been much less clear. Just yesterday I returned from the annual meeting of the American Society of Hematology where we presented our infant leukemia work. I think our ideas are starting to permeate more into the thinking of other investigators looking into the genetic mechanisms of pediatric cancers.
In addition to pediatric cancers, CDI researchers use genomic technology to study pediatric lung disease, musculoskeletal and metabolic disorders, and congenital heart disease. CDI faculty scholar Dr. Beth Kozel studies vascular disease in patients with a condition called Williams syndrome.
Williams syndrome is a clinical condition that's caused by a missing piece of DNA. Individuals with Williams syndrome can actually come to us clinically for multiple different reasons. They often have developmental delays, so they're slower to walk, slower to talk. They can have a characteristic facial appearance that's often described as pixie-like. They're very cute kids and they're super fun to work with. They're often referred to us in infancy because their pediatrician hears a heart murmur. So they have a fairly distinctive appearance of their blood vessels. I think that the lessons that we learn from studying this rare condition are going to inform conditions that are important for many more children and adults.
Many childhood diseases have a genetic source. Others happen as a consequence of geography. CDI faculty scholar Dr. Audrey Odom has made eradicating malaria her life's work.
Every 30 seconds to a minute, a child is dying of malaria. We've really started by defining a pathway in the malaria parasite that's really important for the parasite to grow and develop. What we've done is begin to screen for small molecules that inhibit the pathway, and then we work to try to make them better. We don't want to come out of this whole process without a new drug. We want to cure children of malaria.
Of course, progress in pediatric research takes not just the passion of a brilliant investigator, but vision and fortitude by funding sources.
With research, there's no instant gratification. It can be a long process. And so I don't know that I was really looking for an immediate impact. What I was looking for is to provide some of these researchers with investment dollars, research dollars, that they could take and take some risks.
Pediatric research is expensive and nonlinear. No amount of investment guarantees success, but without research, there is no progress. Dr. Mary Denauer is the scientific director of the CDI.
It's very difficult to get an NIH grant. There's many good ideas that aren't getting funded. So what are we looking for in a CDI grant? Innovation, excellence of the idea, backed up with a really solid experimental plan. Young investigators are the future. And so we have new idea grants. You have a higher priority if you're an investigator just starting out.
We had an idea that seemed fairly controversial at the time. Traditional funding mechanisms were not going to support that idea. And so the CDI was willing to take a chance. They provided us some nominal funds, and I've been able to generate a lot more grant funding because of that initial investment.
There's no room for patience here. This disease is the single disease that makes the greatest global impact on child health. And the CDI funds literally allowed this project to move forward. We wouldn't have been able to do it otherwise at all.
Children's Hospital brings the focus on children. Washington University brings the broad array of scientific talent across many disciplines. The CDI puts it all together and seeks collaborations in order to stimulate research that otherwise wouldn't take place.
The infrastructure for great scientific collaboration is in place, and time is truly of the essence. Support of the CDI means more kids like Jake will have the chance to spread their wings, become the people they were meant to be, and take flight.